So I had a question on Facebook asking me about what to do, how to avoid a sudden death in the gym. Now, no one can avoid sudden death anywhere, leave alone the gym, but we've been seeing an increased number of cases of sudden deaths, mostly in the gym, and it's making news in lots of places, and people are using that as an excuse to make fun of people who go to the gym, or scare people who go to the gym, or try and beat up on gyms and exercise. These cases have increased in the last 2 or 3 years, and I'm not going to go into reasons why they have increased in the last 2 or 3 years. But what I'd like to talk about today is about how to reduce the risk of this happening to any of us. So the idea of going to the gym is to try and stay healthy and live a long life and be functional even as you age. So it's to retain strength and to retain health. There are people who go to the gym because they want bulging muscles and a flat stomach, a six-pack, low body fat percentage. All of that are good, they're fine, you can do that, but what you should ideally be aiming for is to live healthy life, to have enough strength to function well in your day-to-day life. And you need to be able to do that on a daily basis, and you need to be able to do that without hurting yourself. And this is a lifelong process. It's not something that you do for 2 years and you stop. So if it needs to be sustainable, if it needs to be a constant thing, you need to train in a manner that does not fry your system, basically your nervous system. So what I advise my patients when they start working out after a long gap, or they've never worked out in their life, I ask them to take it easy, go slow. And so some basic guidelines that I tell my patients are, when you're in the gym, I want the session to end in an hour, 40 minutes to an hour, and the process should be done. If you are taking longer than that, it means that you're working too hard, or you're working inefficiently. So that's one thing that you need to remember. The second thing that you need to remember is to remember to breathe through your nose. Inhale and exhale, both through the nose. Now, there's no excuse to breathe through your mouth. It just increases the load on your nervous system. It makes you dry out your airways. You become thirsty, and it basically is an inefficient way to get oxygen into your system. Now, of course, you can breathe through your mouth when you're in a life or death situation, or when you're competing in an event, but that's for emergencies. If you train like you're in an emergency on a daily basis in the gym, you are going to produce accelerated wear and tear, and you are going to increase the risk of injuries and damage to your heart, lungs and nervous system. So that's my second point. The next point I wanted to talk about is holding your breath. When you're lifting, your breath needs to move with the movement that you produce in your body. So you need to inhale and exhale while you're moving. So for example, if you're lifting your hand, I would like you to inhale, and if it's coming down, I need you to exhale. Of course, rules will vary according to your proficiency, but the basic rule there to remember is that your breath needs to move when you're moving, and when you're immobile, your breath can pause. The next point I'd like to talk about is, when you're lifting, when you're exerting yourself, I would like your face to remain impassive, or even better, smile when you're doing it, which is not possible usually, but at least keep your face impassive. So there's no grimacing, there's no gritting your teeth, there's no holding your breath. All of those methods that you use to fire up your nervous system and become a little more stronger than you are usually, it's good in the short term, but in the long term, if you do it regularly, it's going to cause trouble. The final point that I'd like to make is a little more high tech. So quite a few of us are using smartwatches now, and you can set a heart rate alarm on your smartwatch, and most of them are pretty good at picking up if your heart rate goes beyond a certain limit. So I would like you to set an alarm on your smartwatch for 130 beats per minute, and every time your heart rate goes above that, you can take a pause, finish your set, rest, and let your heart rate get back to 100 before you go back to your next set. Now this process can also be achieved if you make sure that you're breathing through your nose. So usually when your heart rate starts to go above 130 or 140, you are usually unable to continue breathing through your nose. That takes a lot of training. So if you practice nasal breathing strictly, you won't need a smartwatch to manage your heart rate. The nasal breathing itself is an indication that you are keeping your heart rate under 140. Now there will be follow-up questions, and this list is not exhaustive. So if I think about something else, I'll put up a follow-up video based on the questions I get in the comments on Facebook and YouTube. And there are other factors that are involved in sudden deaths that happen in the gym. But right now in this video, what I've tried to tell you is, I've tried to show you how to keep the load on your nervous system and your cardiovascular system within a limit, so that you can work out safely without burning out, without doing damage to yourself, and that you can work out sustainably for years to come. So if you've got questions, please put them in the comments, send them to me on Facebook, and I'll do a follow-up video after that. Thank you.